Maintaining mental wellness during breastfeeding is very, very important, not just because of your well being as a mother, but because of your ability to care for and bond with your baby. Breastfeeding can be a very, very beautiful experience, but it comes with its challenges too: emotional challenges, physical challenges, and even psychological challenges. In this video, I'm going to share practical strategies for maintaining mental wellness during breastfeeding. Let's dive right into it. Firstly, you need to prioritize sleep as much as possible. Why does this matter? Sleep deprivation as a nursing mother can intensify your feeling of anxiety, depression, and irritability. How can you achieve this? You will know that babies can be very, very demanding, but you need to be very, very intentional about your sleep. Take a nap when they are napping. Like I said in my previous video, by the time you use the time you are going to you use the time the baby is sleeping with to achieve other things around the house, you find out that before you are done achieving those things, the baby is awake and you are back to nursing the baby, you are back to caring for the baby and all the stress. So when your baby is napping, take that opportunity to nap. It can be 20 to 30 minutes, it can be 40 minutes. It will really, really go a long way for you as a nursing mom so that you don't deprive yourself of sleep. Now, another thing is at night, try to share this responsibility of nursing. Like I always say, no mother carries a trophy of a best nursing mother. No, if you want nursing to overwhelm you, it will overwhelm you. That is why I always preach you should be very intentional about yourself, your mental health, your physical health, your emotional health, your psychological health, even while nursing your baby. At night, you can share this responsibility of nursing. If you have to express breast milk or you have to use the formula, if you are formula feeding, go ahead and do that. Let your spouse help you. Let a family member help you. That's why I always say you should ask for help during this very, very critical time in the life of a mother. There is no superwoman in it. There is no I can do it all by myself. No. Try to ask for help so that while they are helping you out at night with the feeding and everything, the rocking of the baby, you too can catch a few minutes of sleep. It's very, very important. Secondly, always stay nourished and hydrated. I always talk about this, especially being hydrated as a nursing mom. Why is this very important? Breastfeeding burns a lot of calories and depletes your energy. So, as a nursing mom, if you're not intentional about being hydrated all the time, it's going to be very, very disastrous for you because you can lose energy, you can just pass out at any time because while your baby is busy taking from you, you should always replace it at all time. How can you achieve this? Always have healthy snacks around you. Always have juice, always have water. And whatever you are eating as a nursing mom, it should be balanced so that you have enough to keep you as a mother and enough also to pass to your baby, especially when you are exclusively breastfeeding. Another practical tips to stay mentally fit while breastfeeding is to set realistic expectations. Look, before you will say, I must exclusively breastfeed my baby. My sister did exclusive breastfeeding. My auntie did exclusive breastfeeding. So I too, I have to do exclusive breastfeeding. My dear sister, you have to listen to your body. Listen to your body at all time. Do not set unrealistic expectations. Do not expect to do that exclusive breastfeeding because that is what everybody's preaching. That is what everybody's doing. Therefore, I must do it. You have to put yourself under consideration. Are you mentally stable? Are you physically fit? Are you emotionally okay to go through exclusive breastfeeding because it is very, very demanding? So these are the things you should look at before setting your expectations. They must be very, very realistic. If you feel that you are not emotionally, physically, and mentally stable and okay to do exclusive breastfeeding, it is fine. Do what works for you. You can do supplementary breastfeeding. You can add formulas to breast milk. It is fine. The most what matters is that you practice good hygiene and make sure that whatever you are using to feed your baby artificially, it is sterile at all time. And your baby is well, is hale, is hearty, and is growing well the way he or she should. That is what matters, not for you to say, I must do it, when of course you know you are not physically capable, emotionally capable to do it. That it works for Auntie A does not mean that it will work for Auntie B. So be intentional and always put yourself into consideration at all times. Another thing is to ask for and accept help at all times. Look, isolation and exhaustion while breastfeeding can increase mental health symptoms. All right. So while nursing your baby, isolation and exhaustion is something that you should not even think of putting yourself into. Okay. Like I will always say, there is no superwoman when it comes to breastfeeding. Accept that you need help. Accept it and ask for it. If you do not ask, nobody will know what you are going through. If you do not speak out, nobody will know what you are going through. Okay? Don't go through all the stress of nursing the baby. You are doing exclusive breastfeeding if that is what you are doing, and then you do the laundry, you do all the house chores, and you run errand at the same time. You will feel exhausted. You will feel overwhelmed, and that is not what you need as a nursing mom. It is not good for you. It is not good for your baby. All right. So ask for help. Get help. Talk to your partner. Talk to family members. Talk to friends. Let there be people that you can send errands. Do this for me. Do that for me. So that apart from that, it's remove that overwhelming and exhaustion from you. It also gives you time to always be with your baby, to bond with your baby, okay, and to rest as well, so that it does not affect your mental health. And then you can connect with other mothers, join other breastfeeding mothers forum. It can be online, it can be local. When you share, when you listen to people's experience, whatever you are going through, whatever it is you are going through, there are mothers that have been through it. Okay, so by the time you associate, that is why I said isolation is not what you need. By the time you associate, you join forums, nursing mother groups and all that, you hear people share their experiences, you learn. Also, you ask questions, you also learn. Okay, you can follow good pages like Priscilla talking to you right now. You follow my channel and you will see, you will hear and be educated on tips and how you can go through this phase of your life at every point in time. Okay, it is very, very, very important. Another practical strategy to maintaining mental wellness as a nursing mom is to practice gentle self-care. Look, dear nursing mother, you are more than just a milk provider. Yeah, you have a life, you have your body, you have your mental health to take care of, all right? You are more than just that woman that gave birth and you are nursing. Look, if you do not take care of yourself, it's going to affect your baby too in the long run. You should have this understanding, okay? Take things, take time to distract yourself from this whole nursing thing. It is not all about breastfeeding, nursing, washing baby's clothes, bobbing the baby, rocking the baby, having sleepless nights. Don't make that a circle, all right? It can be 10 minutes, it can be 20 minutes. Just take that time. Do something that distracts you. You can watch a movie, all right? You can engage in chats, all right? Just socialize, okay? You can just take a walk. But remember, you cannot do this when you do not have a help. That is why I always preach you need help. It cannot be overemphasized, okay? The importance of help in this very critical time of your life as a mother cannot be overemphasized. So if you must practice this gentle self-care I am talking about, if you must have that little time, 10-20 minutes for yourself, you should have a help. Of course, you're not going to leave your baby in the room and just take a walk and stroll. No. Somebody needs to be there to care for your baby, all right, so that you too can do things that distract you. There is nothing wrong with a nursing mom going to watch a movie. Why not? If not, you can just extract breast milk. Then just take, it can be 30 minutes, it can be 20 minutes, all right? Just to feed your eyes, to be distracted, to relax your brain, and get this whole nursing mother routine off your mind for a minute. It is very, very, very important. Then you should watch out for perinatal mood disorders. Okay, look, postnatal depression and anxiety, they are very, very common, but they are also treatable. Okay, so that is why you have to listen to your body at all times. What are the signs you should look out for? You should look out for persistent worry. Okay, mood swing. Okay, being overwhelmed. Some mothers, you will just see them, they will just burst into tears. They will start crying. And one will think, what is wrong with this woman? Yes, it is because she's overwhelmed. It is because the whole thing is too much for her. Okay? Before you know, she just start crying. Okay? She just burst into tears. You should watch out for all this. So if you are a nursing mother and you just find yourself crying, or you are close to somebody who is nursing and you see all the signs, please, you need to help that woman. She really, really needs help. Okay? If you are always overthinking, okay, if you feel detached from yourself, detached from your family, detached from people around you, and even detached from your baby, then it is a very, very dangerous sign. You shouldn't keep quiet. You should ask for help immediately. Okay, if you're always thinking too much, you're always lost in thoughts, okay, or you always have wild thoughts coming to your mind. Some mothers may even have thoughts of harming their baby. It is not their fault. These are mood disorders. These are mental disorders. It is not their fault. So that is why you that is looking after a woman that gave birth, be very, very observant of all these things, okay? And also, you can avoid all this if you are not overwhelmed, okay? If the whole nursing thing is not too much on you, you won't probably go into this depression and anxiety and having to think too much, having to start crying, having to be detached. You won't do all of that. Why? Because you'll find the whole process very, very easy. So watch out for these perinatal mood disorders. It is real, but it is also treatable. Look, you should understand that you are not failing as a mother if breastfeeding looks hard and impossible, okay? You are not failing. You are not a failure as a mother if this whole breastfeeding thing is not just happening. You are not seeing it. It's just impossible for you. You are not a failure, okay? You are not in competition with anybody. What matters is that you are well. You are well to care for your baby. Mentally, emotionally, you are stable. And that your baby is also fine. Your baby is loved and your baby is fed, is growing well. That is what matters. So take this home. It is not a competition to breastfeed. Don't go and set unrealistic goals. Don't go and compel yourself to do it because other people are doing it. No, always listen to your body at all times. And remember that there is no trophy for the best nursing mom. If it's not working for you, it's not working. You can't force yourself to do it. Okay? What matters is that you are well upstairs. What matters is that your baby is loved and you are there to care for your baby. That is what matters. I'll see you again in my next one. If you haven't followed my page, what are you waiting for? If you know someone that knows someone that knows someone that is nursing, and if you're a woman, of course you're a potential mother, you follow my page for amazing and educative content. I'll see you again in my next one.